Hello, everybody. My name is Dr. Kurt Summersgill. I'm the Program Director for the Advanced Education Program in Oral and Maxillofacial Pathology at UPMC and the University of Pittsburgh School of Dental Medicine. It's kind of combined between the two different entities. I've been the Program Director since the program started back in 2009, and we've had graduates since then, most of whom have ended up doing oral pathology as a career. They're all employed, so if that's anything. Oral and maxillofacial pathology, as you may know, is a fairly small residency, and there are it's a very small profession, and there are very few openings every year for an oral pathologist. Most of us are academic based. This is my office here. It's a mess, of course. But note that I have a microscope just behind me that kind of tells you what I do on a daily basis. Oral pathologists, as you probably know, you think of them as being histopathologists. We look at biopsy specimens of the microscope and then render diagnosis and tell the oral surgeon or the general dentist or whoever what we think the case is. But we do a lot more than that. And our program is specifically focused on being a broad program. So obviously we do the histopathology. We expect you to see quite a few clinical patients in our faculty practice, see lots of oral pathology consults because we're spend most of our time in the dental school itself. So there are a lot of patients with some pathosis that we want our residents to look at. We expect the resident to teach didactic courses and small group activities. One of our residents just the other day hosted a histopathology course with some endodontic residents. One of their requirements is to look at glass slides. So she did that as part of her training. She also wanted to do it. When we do see clinical patients, we hope you can actually do physical biopsies on patients. We expect you to do that. We have lots of rotations in different parts of the university, different parts of the hospital. A really great feature of this program is that I spend about 12 weeks with the head and neck pathologist, which is just across the street from the dental school building, so it's very convenient also. There are also rotations in other hospitals around the city, all related with UPMC, which is a great tertiary care medical center. So I think it's quite a bit of variety. We have some opportunities for research, either here within the school, within the oral biology program, which is also part of the dental school, or with individual researchers at UPMC or at the Cancer Center, places like that. Quite a lot of opportunities. We do allow for some selective or elective type activities beyond the main rotations. We have some leeway into what you can kind of spend some extra time with. We're in Pittsburgh. I'm a Pittsburgh native, more or less. I grew up about an hour away from here, and I came back, as many people do. They go off to school, work someplace else for a while, and then come back. Some of these Rust Belt type cities. It's hard to call Pittsburgh a Rust Belt city anymore. It's eds and meds are the basic industries here, and we're in both. So it's a very stable kind of profession. Faculty here, I've been here since 2000. Dr. Prasad came here in 2005, and Dr. Biladu trained here at our program and then came on faculty in 2011. So we have a very stable faculty. We have 2 boarded oral and maxillofacial radiologists here, and the dental school itself has all the specialties represented and all the training programs represented except dental public health and radiology. So it's a really good mix of dental students, residents, and then interaction with the community itself. We're authorized by UPMC to take 1 resident per year, and that's worked out pretty well. That way, there's typically a senior resident around who can help out the newbies who come in. We are hooked up directly to UPMC into their pathology database. So anytime a patient we need some information on a patient, their medical record or their pathology reports, we can just go right into that without any trouble. We can even, I even link in from my office at home sometimes, especially during like pandemic times, or if I need to work at home, then I can just log in to do a lot of that stuff just remotely. So I really like our program. I'm going to be, I got some gray here. I'll be around leading the program for another 6 years probably. We'll transition to someone else after that, so that doesn't affect anyone who's watching this video. If you do have any questions, our information is on our website. You can just essentially search for Oral Pathology Pittsburgh, and that'll get you to our residency website. It'll also give you a chance to look at our biopsy service, which also has a page when you search for something like that. And feel free to search for UPMC in Pittsburgh. On that webpage, there'll be some links for how you can further explore these areas rather than coming to the city, which is going to be difficult these days. All right, thanks for listening, and contact me if you want at kfs8@pitt.edu. That information is on that webpage as well. Always glad to talk to people, and certainly the residents are glad to talk to you as well. All right, have a great day.